Heard this tune before? Yes, it's the Good Doctor theme song. Hey there, welcome to my podcast, Good Doctor with Sanjana, where we learn about the medicinal terms, diseases, diagnostic techniques mentioned in the show Good Doctor. Yes, you heard that right. We turn Netflix into Edflix. Welcome to the Educational Flex. So let's begin with the first episode Medical DIY. Do it yourself. It starts with an accident on the airport, wherein a glass banner shatters on a teen boy. The doctor implies that his jugular vein has been cut. The first thing you can do is putting pressure on the wound to stop it from bleeding. So, what is a jugular vein? They are found in the neck and are in a pair of internal jugular veins, that is right and left, and a pair of external jugular veins. They are the main path for deoxygenated blood returning from the cranium back to the heart. They are clinically significant in diagnosis of some cardiovascular obstruction as well as useful routes for various types of medication and administration. The left lung is in distress as the boy's left arm veins were exploding. It can be due to venous distension, which is caused by increased intrathoracic pressure inside the chest cavity, which is causing the chest to move paradoxically. That is, it is contracting during inhaling and expanding during exhaling, which is totally opposite of what it should be. Our lungs are present in a pleural space, the space between our lungs and the chest. There should be a specific pressure in this area. If there's too much pressure applied, then the lungs won't be able to expand. Pneumothorax is an accumulation of air or gas in this space, which happens due to a hole that develops in the lung that allows air to escape. This condition is also known as collapsed lung. There are two types spontaneous pneumothorax, which is caused due to any underlying lung disease like asthma or also caused due to smoking. Symptoms are sharp chest pain due to deep breathing or coughing, shortness of breath, and chest tightness. The second type is traumatic pneumothorax, which is due to the injury to the lung, like gunshot, knife, or any wound. As an emergency, the doctor gathers a blade, a tube, and a bottle of whiskey. He drains half the bottle on the boy's chest and his hands, using it as a disinfectant. By using these instruments, he makes a makeshift DIY chest drain to relieve the pressure of air in the patient's chest. He puts one end of the tube into the boy's chest at an incision at the second intercostal space, and the other end is tightly wrapped in the whiskey bottle. He uses a tube and a half empty bottle of whiskey to force air out of the person's chest to relieve pressure. As the air pumps out of the person's chest and into the bottle, the whiskey itself traps the air, stopping any of it from flowing back in, which totally acts like a one way valve. That is, the fluid only flows in one direction and cannot go back up. Now the lungs can easily expand, and the boy takes a deep breath. After taking the boy to the hospital, the doctor noticed a reduced amplitude in his ECG, echocardiogram, that is the graphic outline of your heart movement. The heart is inside the pericardial membrane. If something causes a fluid buildup in this space, it's going to put pressure on the heart. Hence, the heart can't expand fully. With increased pressure on heart, it's going to be less efficient in pumping, which causes the amplitude to lower in the ECG. They believe that a piece of glass traveled from the jugular vein to the brachiocephalic vein, which goes to the superior vena cava, which takes the blood to the right atrium of the heart. The glass punctured the superior vena cava, causing it to leak blood into the pericardial sac. This medical condition is pericardial effusion. They will repair the hole in the wall of the superior vena cava, then drain the blood in the pericardial sac, and the heart starts to function like normal again.